Hey everyone, and welcome back to Women's Wellness Radio. I'm your host, Bridgit Danner, and today's guest is Marc Sklar. He is a reproductive specialist out of San Diego, and we're super happy to have him on the show. Let me just tell you a little bit more about him. So Marc is the creator of marcsklar.com and reproductivewellness.com and the co-author of Secret to Conception. He's also a founding principal of Reproductive Wellness Clinic in San Diego, California. He has extensive experience and expertise in treating and resolving the causes of infertility and recurrent pregnancy loss with classical acupuncture and Chinese medicine. He is a doctor of acupuncture, board-certified herbalist and Oriental medicine practitioner, and a fellow of the American Board of Oriental Reproductive Medicine. He approaches his patients with an open mind, compassion, and medically integrative perspective. Since completing his master's degree, Marc has studied with many prominent figures in the field of Oriental medicine, as well as the Western medicine world. Working closely with his mentor, local fertility specialist Donna Keefe, Marc has been trained and certified in the treatment of infertility in women's health. Marc has also been trained and certified in the treatment of infertility in women's health by nationally renowned Dr. Randy Lewis. He's also trained at Harvard Medical School, where he became certified in mind-body medicine. And he studied many aspects of functional medicine, some of which we will talk about today. So welcome, Marc.
Thanks so much, Bridgit.
Yeah, happy to have you here. So maybe before we get... Yeah, awesome. So before we get into some content, maybe just give us a little background about your clinic and where you are in the world.
Sure. Well, I am happy and lucky enough to say that I live in sunny San Diego. I grew up in Miami and moved from one beautiful city to another. And I've been practicing here locally in San Diego for about the last 14, 15 years. We've got two clinic locations in San Diego, about 30 minutes apart from one another, and I go back and forth between both. And, it's been a lot of fun and really excited about the direction the clinic's going and the amount of couples that we've been able to help and allow them to grow their families. So it's been a wonderful experience so far. No complaints.
Right on. Yeah, and it sounds like similar to me. I started as an acupuncturist and kind of weaved in functional medicine over time, which is somewhat what we're going to talk about today. For our listeners, can you talk a little bit about what functional medicine is?
Sure. When I first got into practice, I really didn't know much about functional medicine. I was really trying to practice classically as a Chinese medical practitioner, an acupuncturist, and herbalist. But I quickly realized that I felt like there was a lot missing to what that training had allowed me to be able to do with patients, especially in the world of fertility, with the amount of Western diagnosis and blood work that patients come in with, usually, not always. I felt like I was lacking in my understanding of what they were going through and the direction we need to take them. And so I started to, as a byproduct of what my patients were driving me to do, started working a lot closer with the Western medical world. And I had quite a bit of training with regards to that in my education, in my degree, but it was somewhat superficial and not tremendous amounts in the world of reproductive health. And so I started to go off on my own, and really, as a byproduct of what my patients needed and how they were driving me with the sort of conditions and complex cases they were coming in with, I started to do that sort of training on my own. And so for me, functional medicine is I kind of try to define it very simply, it's getting the body to function optimally. And to do that, I think there's multiple aspects that need to happen. And functional medicine gives us the tools to do that, or the framework within which to do that. And so there's the functional nutrition side of things and the functional medical side of things, and it's really about taking the blood work that comes that patients have. We have a different parameter or guidelines to look and analyze that blood work with which to make decisions, and that really drives my recommendations when it primarily comes to nutrition and supplements and lifestyle. And so in the practice, we weave together the combination of both Chinese medicine and functional medicine, and we give them two separate diagnoses in the clinic, and that's what really drives our recommendations, both from both perspectives and avenues. In the time that I've started really delving into functional medicine, I've also realized that acupuncture in of itself is very much functional medicine, just from a different paradigm. And so it's been a nice marriage, so to speak, to bridge those two worlds together.
Yeah, that's an interesting point, because I guess if we define functional medicine as creating optimal function for the body, acupuncture and Chinese medicine can definitely support that. But like you mentioned, if clients are bringing in a bunch of labs and they're have special cases, you do need to understand that side of things too. And so I think it's really, really great. I think it's so cool you give people two diagnoses in each system. That's awesome.
Yeah, and it really I find it makes a big difference for me. I try not to get caught up in, I have to give everybody Chinese herbs or everyone has to get whatever supplement. I try to really approach patients for what they need individually and really focus on that and let the diagnosis guide my recommendations and my plan, so that I don't get caught up in and pigeonhole myself in certain areas, which I do find can happen. I think as probably happens in your practice, you start to see patients who have seen other practitioners or other acupuncturists, and I find that, they get caught up in either what they feel they're good at treating or one specific area or diagnosis in the patient, and we kind of put our blinders on and get lost and forget about everything else. And so this, I feel like this kind of it keeps me honest, so to speak. I have to look and keep my feet on both sides of the fence and really analyze things. And it's also why I got involved with the American Board of Oriental Reproductive Medicine, because very much that certification is about being able to bridge the gap between both the Western reproductive world and the Eastern reproductive world.
Yeah, so if people are listening and they're like, wow, this is really interesting. I'm trying to get pregnant, or I'm thinking of getting pregnant. Where do you recommend someone starts and when?
Yeah, that's a great question. I think that when to start really depends on each individual and each couple's goals and desires, and how much time they're willing to put in, and to, so to speak, how much stress they want to deal with, because unfortunately, once you start getting involved in this world and start getting caught up with tracking your cycles and whatnot, there is a level of stress that is pervasive and underlying. As much as we try to regulate that, it is there. So in terms of when to start, I think, the general guideline is between, and this is going to be individualized, but, as a rule of thumb, if you're under 35, give it a year of trying. And if you're over 35, give it, I always say 3 to 6 months. But, if you're 20 and you've been trying for 9 months and you're just frustrated, you probably need to start looking for some care and some attention in advance. All of that being said, I think there's a lot to be said for being proactive and preventative. And so, let's say a couple, or let's say a woman knows that she has the propensity to have reproductive issues or menstrual-related disorders. That's something you want to start to take care of in advance. So if you're having an irregular cycle, or you've known for quite some time that you have PCOS, that's not something I would say, oh, let's just wait till you've been trying for a year and then come in for care. I would definitely encourage those women to start seeking attention much sooner in their life than even if they're not in a relationship or they're just about to get into a serious relationship or whatnot, that they get that taken care of. So that way, when you are ready or they are ready to get pregnant, that timeline is much shorter and they're already ahead of the game. So those are some of my key points in terms of when to get started with fertility care. But I would also caution everyone, I see quite often that patients, when in their mind, when they say, oh, I'm going to start looking at what I can do for these issues, they invariably go to their OBGYN. And I don't necessarily think that that's always the best place to start. But, of course, I'm coming from a different, paradigm. And, my preference is to start with a more natural approach to that process. And because I think patients will get a lot more out of it. If they walk into their OB's office and say, well, I just want to kind of take care of my PCOS or prepare for the time that I might want to start having children and growing a family, they might get nothing at all. They might get birth control. So I just don't think those are the best places to start. I would encourage those individuals to seek out someone like yourself or myself to create a plan for how they can move forward and prepare themselves for the time when they're ready to get pregnant.
Yeah, I think often, even if you've only been waiting 3 months, it's just that part of it is just you just don't understand your body. You maybe never tried to get pregnant before, so maybe the first step you need, like you suggested, is just someone to be able to take the time with you to just analyze some of your, current symptoms and tell you their approach and more about the reproductive cycle, and that may give you some peace of mind as you take that monthly waiting game.
Yeah, no, I agree. I'm amazed, and maybe you feel the same way, but I'm constantly amazed at how little most women know about their reproductive system and their menstrual cycle. And I think as a society, we do a very poor job of educating young women about what's a healthy menstrual cycle, what it should look like, things of that nature, because I spend a lot of time going over that with women in their 30s. And by that point, I would think that they would have at some point picked up that information, but unfortunately, I don't see that.
Yep, it's totally true. So let's say someone is ready to take the step and, say they have been trying like 6 months or a year and they're ready to get some advice. What kind of steps do you take in your clinic with those people?
Yeah, so, I like to take a full history, full medical history first and foremost, but in addition to that, I also like to make sure we look very closely at their reproductive history and their menstrual cycle. Many women take for granted, or they're used to their cycles being irregular, so for them that's normal, or they're used to having a lot of menstrual cramps with menstruation or clots or whatever abnormality that they perceive to be normal. And so I like to take a really extensive history when it comes to that to get some clarity on what their cycle is like and their overall medical history and their family history. I find that a lot of women, their mother or their grandmother had similar constitutions to themselves, or they had reproductive issues, or just overall general health issues, and then it's not talked about a lot in the family. And so when I start asking questions, I do ask them to go back and find out. And sure enough, we find out that they had some health issues, and sometimes they don't play a role, but many times they do, or they're a contributing factor. So it's important to know and get a full, extensive history. But oftentimes I find, especially with younger women, that it gets ignored or just put off for some time is blood work and lab work. Even if I have women who I think are healthy and they're in their late 20s, and for all intents and purposes, hormones should be fine, and they shouldn't really have any irregularities. It's not uncommon to find that they do once we do some lab work and some testing. So I don't like to assume those sorts of things, and I do like to do send them for lab work up front, and some of those things might be on day 2, 3, or 4 of their menstrual cycle, checking their FSH and their LH and estradiol, which unfortunately these days OBGYNs are ignoring, and really just getting an overall history on their reproductive organs, and not to leave out by any means their thyroid health as well. That's often, as I'm sure you're familiar with, very often overlooked or underemphasized in the fertility world. So.
Yeah, I want to ask a follow-up question there. So when you said that I think you said the estrogen markers are getting ignored, and maybe FSH and LH, those tests not being run, or you just find that the results are being ignored in favor of moving on to other, procedures, so to speak?
I find that they're not, so I find very often that their estradiol is not even being run at all, which I find surprising, especially with its relationship and the feedback system between FSH and estradiol. That for me, it's imperative that you run both of them together. The other interesting thing that I found recently is there's a local clinic here in San Diego, a fertility clinic, not an OBGYN clinic, and they have foregone testing FSH and LH for just testing AMH, anti-Müllerian hormone, as their number one marker for reproductive health. And I think that's, I'm not a big fan of that either. So it's just interesting to see where things are headed and what things get ignored as medicine evolves. They feel like, what the new information that we can test for now is much better than the old information, and I don't necessarily believe that. So.
Yeah, I'll second that. Wow, that's really, really interesting. And maybe if you're listening and you're like, what are they talking about? So AMH can be, it's called anti-Müllerian hormone. That can be a marker for sort of egg quality, or how many eggs are in reserve.
Right.
So, and then the FSH that we're talking about, maybe you want to explain a little more about the LH, FSH, estradiol connection?
Yeah, so, I'll just mention, I don't trust AMH that much anymore. I know it's a relatively new test that's come about, but I find there's a lot of inconsistencies in it, and if it's a true marker of ovarian reserve, it should never increase. It should only over time decrease, and I find quite often it goes back up for patients once we start working with them. So I have very little faith in that number, unfortunately. The FSH we use as a marker to check ovarian or egg quality, if you will. And because of its relationship to estradiol, it's a feedback system. They keep each other in check. So you want them both to be in certain parameters, and if it's not, that means the body is working harder to regulate the other, right? So, ideally you want FSH under 10, and you want estradiol under 80, 75 or 80. And so, if you have a patient that comes in, or if for those listening, if you have your test run and all of a sudden you get a number that says your FSH is 7, but your estradiol is 100, it's not a real indicator for what your FSH number truly is, because your body is naturally increasing your estrogen levels to lower your FSH levels, and that's how they communicate with one another. So it tells you that there's potentially some concern over egg quality, and that should be addressed or looked at. And then we always do want FSH and LH to be in a roughly 1-to-1 relationship. If not, it can show some other irregularities in one of those common ones is PCOS, or polycystic ovarian syndrome.
Okay, yeah, that was helpful. And if you're new to some of this topic, we'll just take it a step back too. And that you talked about the AMH as a strict marker of ovarian reserve, and I'm glad you said it changes because I've seen it go up too, and I'm like, oh, they said that wasn't possible. So there's kind of what we're born with and our genetics, and then there's how we influence our own genetics and our own function. So definitely the way that our ovaries perform isn't just age-related, and there's other factors that Marc's kind of explaining that we can look for and deduce. Yeah, that's really helpful. Okay, so you run a lot of labs, and good to note here that some of these labs, even if you go to your OB/GYN, they say, oh, they ran my labs, everything looked fine. We look at it from a different perspective, and we may run some other lab markers, like you mentioned, thyroid, that aren't being covered. So
right.
That's kind of the difference, of going to a functional medicine practitioner that you get and you come have that conversation. So what else do you do in your clinic?
We try to approach, I'm assuming you mean besides lab work or with lab work?
Yeah, I see you made some notes about maybe basal body temperature charting and timing and that kind of thing. You want to talk more about that?
Yeah, and before we move on to that, I just want to mention, because I meant to say it before, is that I do think a big part of the initial testing, I know we tend to focus on women, but I don't want to ignore the husbands or the male partners in the relationship. I do think a big part of that initial testing and so forth and analysis is doing a good semen analysis for men. It's often overlooked, and when you're looking at health and seeing that about 35 to 45% of the time there is a male factor or both a joint male and female factor, it's often overlooked because men really don't want to get themselves tested or just don't feel like it's their issue. They feel like it's the responsibility of their wives, and I just don't want to forget that. I do think it's so simple and straightforward to get that tested up front that I would encourage everyone to have their partners do that, at the onset. So, I'll leave it on that. I can go on for a long time about male fertility as well. So, but with regards to some of the other things we do in the practice, we try to really have a very comprehensive approach. And so we do a lot with nutrition and supplementation, as I mentioned, but one of the things you mentioned was, basal body temperature charting, and I think it's a huge benefit and asset for us, but I do try to balance out the potential stress involved with tracking your basal temperature. I think that gets overlooked, and so, I try to, before I ask someone to track their basal temperature, I do ask them to, I do try to assess if I feel like they are if they have a lot of stress or perceived stress in their life, because I don't want to add another stressor. Basal body temperature charting can be somewhat laborsome to some degree, and so especially when you start to look at your temperatures every day and see what your hormones are doing or potentially what your cycle is doing, you start to get involved with it. Patients start to get really involved with it. So I do try to be careful at how much I ask them to do or who I ask to track their basal temperature. But in a very basic term, I find that the basal body temperature is really great at allowing us to see how their hormones are doing, how their cycle is doing, and the shifting from the first half of their follicular phase to their luteal phase. It gives me like a good understanding of how stressed they are. Really, overall, it's a wonderful tool for tracking. I don't know how much your listeners know about basal body temperature charting. Should I go over that a little bit?
I think a little intro would be a great idea.
Okay. So the basal body temperature charting was initially used to prevent conception. It allowed women to be able to track their cycle over a period of time and be able to see when they were ovulating. And then based on that, they used it to prevent conception. And now we can use it for, hopefully, conception purposes as well. And so what you do with basal body temperature charting is that you, the first thing you do when you wake up is that you reach over and grab a thermometer, and there are specific BBT thermometers because they're calibrated a little bit differently. And so they reach over, they take their temperature, and then they move on. The reason why it needs to be first thing in the morning is it needs to be a resting temperature. And so as soon as they get up or go use the restroom, your temperatures theoretically have already shifted, and so you want to catch that before that happens. So you would track that. You would track your temperature over the course of your whole menstrual cycle, and then we're looking for patterns. So the frustrating thing I find for patients is that they're trying to see what's happening from day to day, and as practitioners, we're really looking to see what happens probably from like week to week or from first half of the cycle to second half of the cycle. So that can be the stressful part or the challenging part, I find, is trying to coach them away from that. So one of the tools that I recommend that they do is that they just take their temperature and they don't look at the temperature and they hand it to their partner or their husband and let them track it and put it into either the piece of paper or their cell phone app, because there's a gazillion of them now. And so I have them track it there, and then their husbands can send it to me, or I can just look at it once a week and log on and so forth. And I find that that's been very helpful because it takes the stress away from her being able to look at it every day and see what's happening today or what's happening tomorrow, because on a daily basis it's not going to be that informative, at least not for most patients. And it just does tend to be a little bit more stressful. So I came up with that idea when my wife and I were trying to conceive, and invariably I realized that I was going to be the one looking at it, so I just told her to give it to me. And so now I just I try to encourage patients to do that if I feel like I still need the information, but I feel like it could be stressful for them. And so I'll have them try that method as well.
Okay, yeah, that's good. I never thought about asking them to ask their partner to write it down. That's clever. And you're right, some people, they don't seem to mind at all. They think it's interesting, and other people find it very stressful. I just say, like, it's just data for me, and you don't have to interpret it. Just bring it back. You don't have to, think about it whatsoever. And I also try to say, most everything's fixable. Anything that we see that looks funky, that once we have that information, we can just fix it. Yeah,
absolutely. Absolutely. The more information we have, the more change we can make.
Yeah, just data. So tell us some other things. Maybe you can get into some of your treatment tools, so to speak.
So in terms of treatment tools, well, one thing I also find is that can be quite off with patients is just timing of intercourse. So that's the other reason why you would use the basal temperatures to create a more exact time for timing intercourse and create a plan for that as well. And I try to make that as stress-free as possible. So just trying to give them a window of time to have regular intercourse versus trying to, specifically time it towards their exact day of ovulation. Although that's great, but sometimes that's challenging. That's challenging as well. So in terms of some of the things we do in the office, certainly acupuncture is a big part of what we do. I tend to rely on it for certain conditions more than others. And then herbal medicine, Chinese herbal medicine, I think is so profound and can have such a big impact on patients. Assuming the diagnosis is done right and patients are able to take their herbs appropriately. Then we do a lot of nutritional supplementation from based on their lab work and blood work and findings, and a big part is nutrition as well. Some of the tools we ask patients to do at home outside of what we do in the practice or dietary recommendations is really also focusing quite a bit on their exercise regimen, their stress reduction tools in in the at home and what they're doing to manage their stress at home because of the type of impact it can have on the endocrine system and just overall on fertility. We do encourage them to do, not for everybody, but we do encourage them to do some abdominal massage and some, why am I forgetting already, castor oil packs for those patients who need it as well. And so really trying to look at all the different avenues that might be affecting someone's reproductive health. You know, I don't believe that there's going to be that I could find one specific thing that's going to be the key trick to changing someone's fertility and improving it. I do think it's a combination of things that's going to make that difference, which is why we focus on those combination of areas.
Yeah, I'm curious when you say you prefer acupuncture, especially for certain conditions. Which ones do you see that respond really well to acupuncture?
Well, certainly anyone who I feel has adrenal issues or their nervous system's compromised and they're very stressed. I think those patients respond very quickly, as you've probably observed in your practice. You know, they can relax in the office quite a bit, and so I think for them to be able to unplug, I think is great. And then there's just wonderful research around using acupuncture for PCOS, using acupuncture for improving IVF outcomes or insemination outcomes. So those are things that definitely stick out to me. And when someone has, let's say, endometriosis, I think acupuncture is great at the pain, at dealing with the pain aspect of it, but not necessarily at the actual, endometriosis or inflammation in the uterus. And so I think that's where I rely more on herbs and diet and supplements. So it's just trying to weave my way through that a bit.
Okay, thanks. Yeah, that was helpful. And yeah, I hope people listening aren't feeling overwhelmed. That we're basically saying, he's gonna craft a treatment based on his experience and what he sees within your case. So again, it's meant to take the stress off of you to let an expert step in and decide. And I also want to point out, this is why, just buying maca on the internet, it maybe isn't working for you. It's not that simple, and every case is different. So like Marc said, there's not like a cure-all for fertility. If there were, it would cost a lot more.
Right. Yeah, I agree. The amount of patients that I see that come in and or who send me a message on Instagram and they say, they're like, I'm on all of these supplements. What do you think? I'm like, I think you're on too many supplements. I'm not sure.
Yeah, you got to know the person. And yeah, sometimes people are great about taking supplements, so they don't even remember why they're on certain ones. And yeah, so. And a lot of them are low quality. That's another thing. That's why it's good to see a practitioner. The practitioner is going to have the good stuff.
In terms of quality?
Yeah.
Yeah. I think that is absolutely the case. I try to tell patients, think of your supplements as either food. As food. Ideally, you want to put the best quality that you can get of food into your body. You really want to do the same thing with supplements. When I don't think we need to buy the Ferrari or Rolls Royce of supplements for every specific thing, but the Toyota is good enough if we can find it and have access to it when it comes to supplements. And most of the time, unfortunately, I find in the store you don't really get that, or you can't find that. So. Yeah,
this kind of the pharmaceutical grade, so to speak. Now that it's synthetic, but that it's that potent is, from your practitioner. So Marc, we're talking about all the kind of natural options in the toolbox. How about when is it a good time to talk to a reproductive endocrinologist, or perhaps think about some other interventions?
Yeah, I think the biggest thing that causes me or patients to start moving in that direction is really a time factor. And that time factor for me is something that's individualized for everybody, right? I can have a 21-year-old come in and she's been trying for 3 years, so her time factor is much higher than someone who just started trying to conceive. So for me, it's a time factor Some of that is based on age, and some of that is just based on how long they've been trying themselves and where they're at in terms of their process and their time. So that's the first thing, and I do have that conversation quite often, right? Even though I think someone who's 30 is young and has 6 months or whatever time that I think that they need to give to trying naturally, if they're done with it and done with trying naturally and they're fed up with it and really on their time frame, it's all about trying to get pregnant. I try to meet them where they're at, but I also want them to have the best opportunity when they go and start doing inseminations or IVF. I don't want them to be wasting their money and their time. So, we probably will need some time to make some changes with that. That being said, someone who has some issues with the fallopian tubes, or there's a structural issue with the uterus or their ovaries, that might be something that prompts us to move a little faster towards the IVF world than other cases. I do believe that about 70 to 80% of couples who go towards IVF probably never needed it in the first place and were pushed there either prematurely by their physician or by the time factor, as I call it. And so it's unfortunate for me. It's unfortunate every time I see that, but I try not to get caught up in that aspect of things. I also believe 90 to 95% of women with PCOS should be able to have a regular cycle and conceive naturally at home if they put in the effort. So some of it is also how much effort do patients want to put in. We live in a society where it's about immediate gratification and results. So we get caught up in that sometimes, and we can't always put in or don't want to always put in the time and energy to make the changes that we need. So that's also one of the factors that pushes, I find, patients to go towards insemination or IVF a little bit sooner. But, outside of that, if everything looks healthy from my perspective in my world, and they've been trying for a period of time, and we're all getting a little bit antsy, wanting to see results, then that might mean that we need to move on to the next step and at least have a consult with a local fertility expert and see what their take is, and hopefully we can all come to a decision on what path is best for them and move forward. And really, my goal is for our patients to be pregnant. And if that path means that they've decided to go to IVF, then I'm going to support them 100% through that. I try not to interweave my personal decisions or thoughts or feelings on that aspect of things, and really focus on what's going to be best for the patient at this moment in time.
Yeah, that was well said. I'd say it is a very personal decision based on, your timeline and even what you're willing to do or not do in this branch of medicine or that branch of medicine. And your age and the personal factors. So, every story is quite unique, and we're lucky that there are some tools out there that are new, new in the last 40 years. But I hope that listeners understand too that we see, Marc and I see lots of people get pregnant without some of those intervening tools. So, there's some very powerful tools that we have in our toolbox as well.
Yeah, absolutely. I'm sure you have stories where fertility doctors told patients that they're never going to get pregnant without IVF or without, a donor, and they start working with you, and sure enough, over whatever period of time, they become pregnant. And so, I see those stories every week. So I have a hard time believing that the majority of patients who go towards IVF really needed it to begin with, but it still might be the path for them that makes sense.
Yeah, totally. It's totally up to you. And I've seen people fail an IVF and be kind of bummed out but still stay on their natural regimen and then get pregnant on their own. So it's always just so exciting for everyone involved when that happens. Marc, I want to tell people more about how they can work with you. Is there any other thing you'd like our listeners to know before we close this conversation?
We've had over the years a big outreach from nationally of people reaching out to us to see how they could work with us and if we work with them. So in the last year or last 6 months, we've really started doing more phone and Skype consultations with women and couples to help them as much as we can from afar, and we've been able to have really wonderful results and make a huge impact. And so we're still doing that, and most people can reach us for that through our reproductive wellness website. We are about to launch marcsklar.com, which will actually make it easier for everyone to be able to access me from afar and have those phone or Skype consultations. So that's really what we've been doing recently. And then so I've been carving out more time in my week to be able to have those sessions with patients and put them on a plan and create the appropriate recommendations for them and move them on their journey to parenthood.
Okay, good to know. We'll have both of those links on the show notes, and I think you've got a free book. Is that the Secret to Conception book? Okay.
Yeah, I think it's a little different. It's not quite the Secret to Conception, but it is one of our. We've got several different ebooks that we offer for free. It gives them like some basic guidelines. So, yeah.
Okay, cool. And the Secret to Conception, where is that available? Is that a different
That's
ebook
on
or is
Amazon.
that on Kindle? Oh, right on. Okay, I'll have to check that out.
Yeah.
Secret to Conception. You can know it.
Well, and that really blends the mind-body approach into fertility is what that's geared towards.
Oh, okay, cool. Good to know. Good to know. Well, thank you so much, Marc. I really appreciate your expertise and your time for being on the show.
Thank you. It was a lot of fun.
Yeah, and we'll see everyone else next week for another great episode. Thanks so much for listening. We always appreciate your ratings and comments on iTunes, and subscribing to the show is the best way to stay in touch with us. Thanks so much. Bye, everyone.
Hi, I'm Marc Sklar, the Fertility Expert, and if you're getting ready for an IVF transfer, then keep watching because I'm going to give you my 5 tips to prepare for IVF.